This is a question for
Greg.
Greg, yes.
Okay, great.
Thank you for presenting all of your models. Very, very interesting. I have a question about a specific implementation program. We often deal with very low-frequency events. For example, going into a long-term care facility and dealing with people who need assistive technology to communicate. It's not, certainly every client in the facility doesn't need it. Do your models change if it's a very low-frequency problem that we're trying to address? And what strategies would you suggest that we use to solve the problems of people saying, well, that happens so rarely?
So this issue came up. I was giving a talk at the Adolescent Trials Network for HIV, and someone had done a big survey of all of these clinical sites for adolescents and kids with HIV, and the frequency was so low that I remember thinking, so why does that matter? And it was someone else in the audience who mentioned that the cost of treating and maintaining HIV care for one child or adolescent over the life course is so high that the public health and cost impact becomes very significant. So that's the way I think about those. And this is grantsmanship also, is making the public health significance argument, and that could be in terms of patient suffering, in terms of patient care, but also burden to the healthcare system. I don't think the models necessarily change in terms of that, but it might impact what implementation strategies or approaches that
So
you
you're
use.
saying we need to be better advocates for the importance of whatever intervention we're trying to implement? Is that-
Yeah, but
Yeah.
reasoned argument backed up by data to make your case.
We spent some time yesterday talking about the fact that there are some evidence-based practices that shouldn't be implemented. We switched the focus today to the organization, and I wondered, are there organizations that should not be implementing? We talked about the contextual assessment and some of these things. Are there thresholds for which, when you're evaluating these opportunities and you say, you're too far gone, or you really need to come along here?
So I think Charles Glisson would probably have some things to say about that. So Charles's work on assessment of organizational social context, he's been profiling organization, compiling essentially a database on different profiles of organizations and how effective they are. And I think that's some of the best that I've seen in moving us towards an understanding of the context just in terms of operations. We've had this discussion because the area that I work in around organizational context now is more towards strategic organizational climates. So, what's your particular climate to support an evidence-based initiative or practice? And I think Charles's work on the hand is more global in terms of how high or low functioning is this organization in terms of their dimensions of climate and culture within the organization. So I think we're moving in the direction of being able to understand that, and that pre-assessment would be good. So I have a study, actually, that I have to revise and resubmit, but we proposed to test this leadership and organizational change intervention in 60 substance abuse treatment programs. But we're going to have about 80 to choose from. I mean, I think your question raises an issue. Maybe we want to do some baseline pre-assessment and then make our assignment decisions.
Yeah, the other thing I thought was the potential that an organization is sick enough, to use this term, that you could see a greater effect size. And so you might pick organizations that had really poor leadership.
Well, I think the question there would be, if you're working on organizational climate, for example, it may be way down there. So in terms of one of your implementation outcomes may be change in organizational climate, would that still get you to the level where you could implement a practice effectively, or do they have to go even further?
Yeah.
And so that gets, I think, at the interplay between different types of implementation outcomes.
Yeah, and I think your question raises for me, the issue of who's asking this question. On the one hand, part of Greg's answer was from a researcher, or maybe a treatment implementer. What agencies do you want to partner with? And then I think you need to figure out where's the best opportunity for success. And we've had some really interesting discussions around this in the Implementation Research Institute about whether implementation science should be conducted in only the most high-functioning agencies or a range of agencies. And I've actually heard some people argue that at this point in science, if we're developing approaches, implementation strategies, maybe we should use really highly functioning settings, because that's going to give the best chance to refine and perfect the strategy. That's akin to an efficacy trial. In efficacy work, we try to clear out the noise. And in effectiveness research, we try to bring it in so that we can see how are the findings affected by all this between variation and within variation. So it's a really interesting question for researchers, and I think it depends on where your implementation strategy is in its state of development. I have a little bit of a pushback because the longer we continue to cherry pick for our research studies, the longer we prolong that pipeline of, okay, well now then we have to test it with more poorly functioning agencies, and then we have to test it with middle of the road. But on the other hand, I don't want to fail either, and we don't want to waste precious grant resources to not give something its best shot. So it's a very, very complicated issue. For service recipients, I think we're a long way from them, from our fields being transparent enough for them to say, where will I receive evidence-based practices? And for agency directors to say, should I be trying to deliver evidence-based practice? So another question that your question triggered in me is, who's asking the question and for what purpose? And I think the answers may differ by those. I'm working with a national group on trying to assess federally qualified health centers' capacity to deliver integrated behavioral health care. And we had a question on the conference call yesterday was, well, are we going to categorize these agencies as ready, capable, or not? And we said, well, no, given the policy environment and the demand, what we need to characterize it is how far does each agency have to go? So, the assessment is not to categorize as yes, no, but to say, if you're going to start doing it, you got a long list of to-dos. If you're going to start doing it, your to-do list is a little shorter.
Thanks.
Sorry, I muddied up the question, but
Good.
So I have a logistical question. I know that a variety of measures exist for assessing implementation outcomes, such as the EBPAS. But from a practical standpoint, do you have recommendations for getting stakeholders